I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I would like to introduce Brittany. Brittany is the mother of Simon, who has had less than a comfortable experience with food allergy and intolerance. Welcome. Thanks. So you have your baby, and your baby was a little more fussy than typical. Why don't you tell me about that?
Well, the first, 4 months were just miserable. I think he just screamed excessively, and I didn't know if it was the difference between something really wrong or, he was my second, so knowing if that's just how a second baby acted. And one night he screamed so much, he was screaming from, I think, about 4 p.m. to 11, and we just didn't know what to do. I would just lay him down and kind of leave him there so I could get a break and then go back in and try to comfort him, and nothing really worked.
When he screamed for so long, was that just nighttime or was it all day and all night?
It was pretty much all day and all night,
Mm-hmm.
lots of hours at a time.
So when one thinks of colic, we think of a baby who is a dream in the hospital, will cry an hour or two per day during the first month or two of life, and by 3 to 4 months of life they're crying 3 to 4 hours per day, and then at 4 months it all goes away. This didn't really fit that, did it?
No, I kind of looked into that, and it just it didn't quite fit the mold, but he just cried so much that I thought it must be colic or it must be something more serious. Before
you had an indication of what was going on, what had you tried to relieve that?
Well, I would feed him, I would change him, I would rock him. My dad would come over and walk him around the block. My husband would take him and walk him, and we did everything we knew to comfort a baby. And those things just didn't work.
What was your first indication that maybe it wasn't just simply colic?
After a couple months, he had blood in his stool, and so that obviously scared me. We went right in and did a sample, and after a couple weeks, they discovered it was lactose intolerance or something like that.
Intolerance or allergy,
yeah.
or something was going on. When you talk about blood in the stool, how much was there? Was there a ton, or was there a little streak?
Just little tiny specks. They just looked like little dots of darker color than newborn stool.
Was it clear to you that it was blood at first?
Not at first, but it took a little bit. My husband and I both kind of checked it out and saved the diaper and called the doctor, and then we figured it out. And after, I think he had 2 diapers with it before we did the sample. It's really hard to know how to test a baby when this happens. Obviously, when a baby is brought to a pediatrician, because there's blood, we worry about obstruction, we worry about inflammation, we worry about other things that are going on that are very serious. But in this case, your baby's growing well, gaining weight well, has calm periods, and is crying in little specks of blood, correct? Right.
And often in my office, I'll check for blood in the stool to make sure that it is blood, which it was, and then we'll check for, I like to check for something called reducing substances, which is a test to see how well the sugars are digested in the gut, whether they're being digested or they're just passing through. And then if they're passing through, it gives me more of an idea that we might have an intolerance here or some reason. It's certainly not a specific test. There are many reasons why it can be positive, but it gives me an indication of which way to go with that. And I believe it came back positive, and we're thinking, okay, we have some type of allergy or intolerance to milk. And then the question is, what are we going to do about dairy? And that's a little complicated because you're breastfeeding, right?
Correct.
So what did we recommend for you based on your breastfeeding?
Well, I just cut out dairy, so I don't eat dairy. Cut out cheese and milk and yogurt and all that stuff. And we tried a few other things as well when I changed the diet, but it kind of came down to just the dairy, and I just cut it out. I would say within 3 days, he was a new kid.
Really?
Yeah, he was so much happier. It took a week or 2 to figure out what I could and couldn't eat, but then once I kind of had a system down of meals that didn't have any dairy in them, he was so much more calm, easier to calm when he was fussy. He started sleeping more. Just, it was an instant.
Sometimes when a child is breastfed and we're trying, bottle fed, excuse me, and we're trying to figure out which way to go, we switch formulas, and I will go to something that is considered non-allergenic or hypoallergenic, because if we switch to a soy formula, there's still a chance that the baby can have the same problem. You don't really know whether you've eliminated the issue or not. But when breastfeeding and you can eliminate dairy, that's great. And it can take up to 7 days sometimes to really know what changes happen. At that point, we're left with a question of what to do, because we still have this issue of how he's going to do with dairy. And by now you know that it's not really clear-cut when to reintroduce dairy, is it?
Right. I guess that's the big question now, is when should I start introducing it while still breastfeeding, and when should we give it to him when he starts to eat more solid foods?
And that number really varies from person to person and how they decide to do things. 1 year is often the mark where someone will consider trying to reintroduce something. Thank you, Brittany, for joining me in discussing your son's milk allergy / intolerance and what was going on here. I am Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please visit us at drcareys.com, where at Dr. Carey's we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay. Let me see your ear.